is our president-elect for next year. He'll be the president again, and so I'd like you to give a warm welcome to someone who lives right here in town, a block and a half down the street. His practice is thriving, Dr. Nicholas Meyer.
Thank you, Dawn. Thank you, thank you, thank you. And welcome back to the after lunch crowd. I know this is going to be a struggle, I hope not too badly, to fight the urges of that chocolate that everybody took in so nicely, myself included. And, excuse me, true enough, Dr. Allen, whose picture is on the slide here, and I conversed numerous times, emailed oodles of times, and he's got a really neat project that he started about a decade ago. And he had some ideas, and we're going to go through this slide. But what this reminded me of as I look through this, there's a story. Now, we've heard stories from Dr. Minkoff. We've heard stories from Blanche Gruby. And we all have stories. And one of the stories that I remember most is as a family, and I'm the eldest of 7, so I had mom, dad, 7 kids, and a family dog. And we'd pile into the family station wagon. We had a Pontiac Grand Safari with the plastic wood grain on the side, white car, and you can imagine all these people all scrunched into it. And the reason I bring this up, because it reminded me of a simpler time. So when I saw the sides that he had sent me about this story that he was trying to convey that brought him to this point, triggered with me that memory. So my memory of my family and all Norman Rockwell-esque kind of family vacation. Everybody's happy on the way out the door, but they all bedraggled and coming back and fighting and being all messed up. So with Dr. Allen, he introduces us to his family. And the reason he's bringing us into his family's life and their history is very simple. He wants to illustrate a shift that has occurred in the healthcare within America. The people of this country are sicker today. We have different diseases than we had back when he's telling this story. And we listen to some pretty horrific stories about people and some wonderful stories about the disease processes that we have from the mouth. Well, this is a little different. This is going to be a story of how working within the mouth, you have the opportunity to make a big impact on some of the diseases and the processes that we have today, such as diabetes and obesity, etc. So the story that Jim is telling us is going to be unfolding now. So he goes back to 1900. He says, what was killing us? What were some of the major causes of the mortality and morbidity of the day? Well, if you look, it's about almost all infection. There was some trauma, but infection. And through time and energy and changes, that model shifted. Here's where his family story comes in. And this was a difficult transition for me, trying to get into his shoes and into his head as I'm picking up his family story to try and make it my own and deliver it where it's a nice cohesive, it's not interactive, but a delivery of his family's story. But he tells the story of his family with their disease processes. Here's a great-grandfather died of a sinus infection, 1939. Then his grandfather on the mother's side, another infection, kidney infection. Now he talks about his father. His father enlisted in Pearl Harbor right after at age 16. He comes back, and then he meets the woman who signed him up to go into the Navy. And they got married shortly after the war in 1945, and then she died just 5 years later from polio. Again, more infectious disease type processes. So then we start to change, and this group of kind of elder statesmen, a lot of older people in the audience, we were at the early stages of a lot of these changes. There was a change of water quality, change of personal hygiene, grooming habits, refrigeration, more reliable food sources. and antibiotics, of course, came on the scene. And then, not that I'm an advocate, these are his slides, but vaccines had entered the marketplace. So these were some of the things that he said in his journey is what changed within the fabric of America in the healthcare. So now, where are we today in 2018? Well, you can just look around and we saw the kind of disease processes. Infections are still alive and well. A lot of them come from within the oral cavity, hidden root canal problems and jawbone cavitation, lesions, etc. And he's maintaining that much of the disease process that results in obesity, diabetes, hypertension are due to lifestyle choices that we make or don't make. How conscious are we of the choices that we are making? Do I need that extra cookie at night? Do I need that glass of wine at night? Do I need to have that chocolate cake, et cetera, et cetera? So these become our... I had all those. So I think you would agree that that is probably very apt. We see so much of this. This is on newspapers, news broadcasts, and regularly about the condition of the health deterioration in America around these disease processes. Now, we can also make some arguments around the challenge with airway, like Felix talks about, like I talk about, with respect to some of the challenges that you're not oxygenating your body well enough. So it's not always just one thing or another, but this coming together of so many different elements. So what he thought of, and this is now where his thinking changed around the late 2000s, he wanted to, and you'll see why, he came up with an idea that if he could control the switches for behavior, he could make a change in that behavior. And that put him on this particular path to bring us to where we are with this presentation today. But still in all, the control rests, where's my little button here? Control rests with the patient or the person who is going to wear a device. Now, Dawn ended up ordering one of these devices, and you'll see that shortly. It hasn't come yet, and I have not ordered a device, just to even have it as a show and tell in the office. But it's really a cute little thing. Now, so here's the background. This is his story. As a practicing dentist, he's not actively practicing any longer, but when he was practicing, give or take 10 years ago, he had a patient in from China. This person was a professor, medicine in Beijing, with a specialty in acupuncture, acupressure. Now, that's pretty good credentials, and that's widely accepted over there. You know, it wasn't until Nixon went to China and came back that acupuncture became more accepted here in the States. And it's still, you know, in pockets, there are no places that you have access to people that do acupuncture. Here in the Southwest in Arizona, we have oodles of people. We have acupuncture schools. We have the School of Naturopathic Medicine. We have a Medical College of Homeopathy in town here. It's a 4-year homeopathic degree program. So we are blessed with all kinds of alternative care providers in our little area. And it's a growing area, and that's one reason we have a good success rate, I think. But, so he was doing some CE, no different than you and I are sitting here in this audience. Recent program for him, TMJ, facial pain and headache. Very common. Many people go to these kind of programs. I have for 35 years. And during that program, these are all his slides. He's reviewed alternatives of acupuncture and acupressure as an aspect of that program. So not everything that we see in headache has to be done and treated with a pop, a piece of plastic, a splint in the mouth. And acupressure and acupuncture are viable treatment modalities. So he engaged a conversation with this Chinese physician, and he says, are all these, he's talking, you know, points about the ear. He says, well, what about points that may be inside the mouth? Now, those of us that have been around a while know that there are indeed the acupressure points and acupuncture points in the mouth, somewhat. There is a knowing of that, whether or not you're an active practitioner of giving acupuncture injections for neural therapy in the mouth or not, I don't know. So here's a view of the palate, and this is what they came up with, and Jim now, this was about 10 years ago, this was a revelation to him, and this is what he ended up during that conversation with that doctor, what was discovered in his mind. So that really set him on a thinking path. If these were so, maybe he could do something dentally to stimulate that from an acupuncture perspective that would be in the control of the patient, that really wouldn't need to have much doctor influence, going to have needles placed here and there to have management. So everybody can see where the teeth are. You can see the various areas, heart, lung, liver, etc. Well, most people that are in this area are inquisitive. We're an inquisitive group of people. We want to know. And so he dug deeper, and he brings us to this. Now, everybody here has, I've seen several of them out, some way, shape, or form rendition of the top chart. Here's the palate and the acupuncture points. And I suggest for you folks in the audience, this is a great website if you want to look for products, and they've got a big list of products on their website to have as your resources in your offices. It's pretty amazing. And if you're not in a metropolitan area where like we have these schools around, I can go to a school, you can just go onto that website and find it. Probably Amazon too. But now, Dr. Gleditsch, who was a German medical practitioner, I lectured with him in Vienna, Austria about 15 years ago. He's an expert on oral acupuncture. And his program was all in, oops, sorry, I spilled the beans. Oh, there we go. Okay, so Dr. Gleditsch is an expert on that. And just to show, this is in the literature, acupuncture literature in dentistry. So this is not a new concept in dentistry for many people, but other people that are newer to this, it would be a new concept for them. Now, I'm showing you this. This is the actual patent process that he went through about 10 years ago, showing that this is basically a dental retainer, right? You can see the labial bow here, got a little clasp, but this is the difference in what he discovered as the placement of these, like the head of a pin, a large round pin. So these are bumps that he's got located strategically to stimulate those particular points in the mouth. So when you place this retainer into the mouth, those bumps or points, prongs, you can use whatever analogy you want, actually then nestle into the soft tissue and activate the acupressure points. Okay, so that's this is a little bit closer view of it. Now, the newer one that you'll see shortly is a slight deviation from the design, but the principle is exactly the same. It will still have all these pressure points. The application to the FDA, and this is 510K summary. So this is all to show you that he's wanting to show you the legitimacy of the product. And this is now registered with the federal government. You can see the date on here is 2010, so he had been working already for a couple years on the product and getting it ready to go through this 510K process. So one of the things that he did in preparation for an attack, which never happened, was to query the medical board, and he did later query the dental board. Is it okay for me as a dentist to offer this service to the public. And they basically came back and says, we don't have a problem with it. You're doing it on your own. You're having these devices made. And then it says down here, contact the Board of Dentistry, since Jim was a dentist, and he's writing to the medical board. So they said that there's no problem for him. And then subsequently and I don't have it in this presentation, but if you'll believe me, he did get a similar response from the dental board and said there's no problem for him to be using this kind of device for the application of acupressure with the resultant outcome of behavioral modification and appetite suppression. This device is simple looking enough. I think any one of us could really probably make one of these in our laboratory. To use these appliances and use this technology is a licensed procedure from him. And there's only one lab that is allowed to make these devices that we practitioners would have to use for that service. If you're going to say, I'm using this device. As an analogy, I have a Millennium laser, and it can offer the LANAP procedure, laser-assisted new attachment procedure. And I have a license which allows me to market the LANAP service to the public and my advertising and things like that. If you have a night walker or some kind of erbium YAG laser that maybe can do something similar, you cannot use, unless it's illegally being used. You can't say that I'm a LANAP practitioner using a wavelength which is different than the Millennium laser, which is patented that whole procedure. So this is a lab-specific appliance which has to be designed and provided by this particular lab, and I'll show you the websites for that. Okay, so the acupressure point stimulation is about controlling of the behavioral switches. It's up to the individual who has the device to be made to wear the device. So basically, his requirement is you wear it for about 20 minutes before you have a meal. And that's supposed to trigger the brain to help control the amount of desire to eat in advance of the meal process. So like we just had lunch, so say that happened at 12 o'clock, so give or take 11:30, you'd pop the appliance into your mouth in preparation for the meal. So that would tone you down so you wouldn't eat so much. That's the nature of the concept behind this. So we're controlling the behavior switches that are responsible for this. Now he had an ulterior motive, and that's going to be seen here. Come on. Okay. So he chopped his head off here. But he became, through just whatever happened in his life, he became a bit heavier than he'd like to be. So he was 247 pounds. And so here's his questions. He has, should I have that like glass of wine or two, the last piece of cake, the hunk of cheese, and, you know, thoughtlessly just doing this kind of thing. And then one day he woke up and he said, I think I have to make a change. So he wanted to see if this whole thing made a difference for him. And it did. And you'll see that. So this device, obviously it's just a little piece of plastic with little spurs on it, will not directly affect weight loss, but it's a behavioral control device. So it's only to assist the aid. So here you have a crutch now that you can readily use. Now this is something that you could use in your practices for your patients, and there's another way, which we'll show next, how the patient can actually have it on their own. So this is Jim, some months later after using this, and then he embarked upon an exercise regimen, and we'll see what that is here shortly. So what he did, he weighed and measured everything for 30 days. Walked every morning for an hour. He biked, snowshoed, and skied. He lives up in Oregon, so it's really easy for them to do all that outdoor things. We don't get much snow down here in Phoenix. So, but anyway, he was at a strength personal trainer for 30 minutes a week. So it's a combination effort, right? Again, he's controlling the behavioral switches to have oh, that's good. Okay, now, hold on. Now, what you're going to see here is he wanted to make this available to a wide group of people. So there is, I don't know if you're aware of this, but there are now laboratories which deliver services directly to the public without having to go through a dentist. So there are aligners, like orthodontic aligners you can have. They actually will make partial dentures, full dentures, orthodontic retainers directly to the public. So this is the self-care option.
Have you tried countless expensive programs and supplements to curb your appetite with no results? Are you a midnight snacker? Do you often eat not because you're hungry, but simply because you're bored? Do you find yourself overeating or indulging in foods that just aren't good for your body or your waistline? Introducing the only device that can stop your cravings and prevent you from overeating with no monthly costs. The Intraoral Technologies Acupressure Appetite Suppression Device. Acupressure has been used for centuries in China as a way to heal the body of toxins and improve blood flow through pressure points connected to various parts of the body. From headaches to hunger, applying pressure to these important acupressure points has been a practice used in medicine for decades. The Intraoral Technologies Acupressure device is FDA approved and has built-in pressure points that stimulate acupressure points connected to the stomach, preventing hunger, stopping you from overeating, and helping you kick your unhealthy eating habits. It's invisible and lightweight, so nobody has to know that you're wearing it. Simply wear the device for 30 minutes before meals or late at night when that ice cream in the freezer is calling your name. Not to mention, all of our devices are FDA approved and are quality checked by certified dental technicians right here in the USA. Simply purchase your device online and we'll send you a teeth impression kit. Or we can also use your previously approved putty impressions, dentist-made impressions, or a digital 3D model of your teeth. Send your impressions back to us using the postage-paid shipping label, and with your impressions, we'll create a device that fits your mouth perfectly. Are you ready to kick your cravings to the curb and begin your journey to a healthier, happier you? Order your Intraoral Technologies acupressure device today.
Now, I don't know about you, but I think it's pretty amazing that there are dental labs now that are going out, reaching directly to the public to have things made. So I still think this is a good doctor-controlled procedure. Now, so one of the things that was interesting as I researched this, if you go to the website, I'll show you the name next, there's a companion device that's made, not just, this one's specifically for the acupressure. They've created another device that actually has small little wells built into it. And that's caught the eye of the pharmaceutical industry as a medication delivery system, like a little reservoir, so that would sit up against the palate and the tissue would be, the medication then would be absorbed through the tissue, and for somebody that can't swallow pills or has some other challenge, they can just put this little, whatever it is, let's just say it's like a CBD oil, put it in some drops and put it into the roof of the mouth and have it absorbed that way. So I think it was a very clever idea, but when I spoke to Jim about this, he did say that it has the eye of the pharmaceutical industry as a medication delivery system. Now, I don't know where that's going to go. It's at the very beginning part of that whole conversation. So where are we? So this is a whole, we did that one. Okay, so as I was saying, this is available through either a doctor deliver or the online system. And I'm going to try to, the laboratory that is in here, this one here, this fromhomedental.com, I think I can activate, I'm on the internet here. see if this shows up. I have it on my screen, but I don't have it over here. Oh, I gotcha. Let's see. The last time I did this kind of thing, I dumped me out of the program. I'm sorry, folks, of my clumsiness. Oh, there it is. Okay. Okay, now go away. How do I get that to go away?
Just click on the left part.
Okay. So this is the website, From Home Dental. Has anybody here seen this kind of service? I was blown away a couple weeks ago, about a month ago, when I was checking this whole thing out. There's the two devices here. Again, I was saying they changed the device so it doesn't have the labial bow on it. It's all a plastic, like a thermoplastic type of thing. And then here's the other one, which has got the little reservoirs built into it. So we've been talking about this device, and that's the one that's out there, but I don't know if it's had much clinical application yet. So now, this is, you get from the laboratory, if you order online, just what we're showing you here, either you or the patient will pay $219. They get 3 different sized impression trays, because they don't know your mouth, and a putty impression material. I think they send you like 3 mixes, one to play with and screw up, so you get the feel of it. And then you take and make your own impression. You send it in that envelope back to the laboratory with the funds, or maybe you pre-buy it, I guess. And then they will turn around, make the device, and ship it back to you. It's really that simple. Now, the thing that's interesting is over here on the right side of the screen, the categories of what they make for people. Direct to the public. Yeah. Clear liners, devices for missing teeth, flippers, partial dentures, anti-snoring devices. I think this is pretty amazing that people are able to get this without the intervention of a dentist. Of course, we all know that if they get screwed up, they're going to have to come to see us anyway to help unscrew them. So let me scroll down a little further so you can see sports guards, whitening trays, there's your impression putties. So again, this is a neat application of old standard dental procedures with a little twist to affect the different change of a behavior, and from a different way of providing a service directly to the public. And that can help in, great unwashed areas of the country where there may not be a dentist that would otherwise do these types of procedures in small towns, say in Kansas or Nebraska or fill in the blank state. And let me see if I can go back here now. See if this will work. Okay, now. function. Okay. There we go. Where did it go? It's hiding. From Home Dental. There we go. So basically, there's these 2 pages out of this company's business, and this is what you would order. This is what the patient would see predominantly. And we were given, Jim's plan is that we are the first group of healthcare practitioner dentists to have the opportunity to bring this technology to the dental public. And so this was kind of an honor for us if you want to embrace this technology in your practice. It's a cleaner, less messy, kind of gooey thing compared to taking teeth out and doing bloody surgeries. But this is what it looks like, the clear. It looks like this is done just on a suck-down machine that's got some holes punctured here and there. So this is the device. And really, this is all I have as far as there's this patent number, 9 million something something. So, well, that's all I have as far as the presentation that I was given to give this little dog and pony show about. Are there any questions? I'll see if I can answer them. I'm not an expert on this, but it did work. I think it went off technologically okay. No questions? Okay, well then I'm done.